Let me introduce myself. My name is Kаспарова Кристина. I am a first-year student of the Faculty of Dentistry, Saratov State Medical University. I present my report, Spinal Muscular Atrophy, the latest research and treatment development. SMA disease is a rare but severe disease that affects children and adults. It results in muscle weakness and atrophy, which can lead to impaired breathing, swallowing, and movement. Despite significant progress in the treatment of SMA, it remains a serious problem with high treatment and care cost for patients. The relevance of a report about SMA is the need to share experience and knowledge among medical professionals, research, and patients in order to improve the diagnosis, treatment, and quality of life of people suffering from the disease. Every year, about 200 children with SMA are born in Russia. There are 5 forms of the disease, the most severe being Wernicke-Hoffman disease, with the first symptoms appearing before the age of 6 months and progressing rapidly. SMA was previously considered an incurable disease that often had tragic consequences. However, thanks to significant advances in medical science and technology, it's possible to fight the disease. Today, we can talk about real chances for recovery and improvement of the quality of life of patients with SMA. This gives hope and motivation for the further development of research and treatment methods for this disease. This disease has been discussed in society in the media only for a few years, although the disease itself, of course, has been known to science for a long time. It was first described in 1891 by the Austrian neurologist Wernicke. Today, spinal amyotrophies are of practical interest to a number of disciplines: child and adult neurology, pediatrics, and genetics. Previously, doctor could only offer palliative care. This is sanation of the bronchial tree and keeping the body upright with the help of a verticalizer. Sanation of the bronchial tree is a therapeutic measure to remove mucus buildup on the affected bronchi. Patients with spinal muscular atrophy often have difficulty removing sputum or mucus from the upper and lower airways to their own. A special device, aspirator, helps to cope with this problem. It removes sputum and mucus from the nose and oral cavity through special tubes using vacuum. It's also possible to maintain the upright position of the patients with the help of a verticalizer. Some types of verticalizers allow you not only to remain in a standing position, but also to move around. The key purpose of the verticalizer is to bring an upright position and fix the person. Verticalizing results in some improvements. For example, ventilation of the lungs, mobility of the joints, and normalization of circulation. Without respiratory support and the verticalizer, babies rarely live to be 2 years old. The above-mentioned methods of treating patients with SMA are still used today, but today there are drugs which are aimed at increasing the level of the functional protein SMN. It's reduced in people suffering from spinal muscular atrophy. If you start treatment in time, you can avoid the serious consequences of the disease. There are 3 drugs currently used to treat SMA. In August 2019, the pharmaceutical company Biogen registered 2 drugs Spinraza in Russia. The drug is injected into the spinal cord every few months. Such injection should be made within lifetime. In November 2020, Roche's Evrysdi, which is similar to Spinraza, was registered in Russia too. Finally, the most well-known drug for SMA is Zolgensma. It should be noted that the cost of one injection of Zolgensma is $2.1 million. Zolgensma is the most expensive drug in the world, but it allows this disease to be cured and changes reversed with just one intravenous infusion. All three drugs are aimed at the same result, which allows the child to develop according to age. But all this will be effective provided the therapy that was prescribed at the very beginning of the disease, before clinical signs developed or they were insignificant. The later treatment begins, the more difficult it is to restore motor function, breathing, and swallowing. Also, as the disease progresses, multiple complications arise, which are often irreversible. We can talk about the real chances for recovery for patients with SMA thanks to advances in medical science and technology. Our help is not limited to raising money and spreading information. We can look forward to further advances in research and treatment for this serious disease. This gives us hope and motivation to keep fighting for the health and well-being of patients with SMA. Together, we can do more and help those who need our support.